Let's talk a little bit about what your company does and how you're solving and how it's different.
We manage patients that have inflammatory bowel disease, which is Crohn's, ulcerative colitis. It's a very high-cost disease. It's very disruptive to your life disease. In fact, I am currently at Ochsner Health System in New Orleans, and I got to spend the morning at their IBD clinic learning a little bit more about how they manage their patient population. And so I got to hear all the stories. I got to use my listening to hear all the stories about what do they face? Because, you get to come in and see your doctor every 6 months or maybe once a year. So what happens in between those visits? We're the in between the visits. We are reaching out to the patient a regular basis and collecting their symptoms. They don't have to say, if you have a chronic disease, you're like, I don't know. I don't know if I'm a little worse today or not. Like I think I'm the same. I don't know. So you don't have to think that. You get to we collect symptoms on a longitudinal basis. We calculate a score for you, and then we compare your fluctuations to that score so that we can determine whether or not you're potentially deteriorating and need to get in to see a doctor. That's the acute part of what we do, but we also pair that with wraparound services. So it's not just that your check engine light has gone on, we need to also make sure that you're getting your oil changed on time. So how can we connect you to the right nutrition therapy or GI trained psychologists or sleep resources? Because that's a huge, huge issue. Your inflammation creates sleep disruption. Your sleep disruption creates inflammation. So you gotta fix that cycle. We're really everything that we can be to manage this very difficult set of patients. From a business model standpoint, we do this by contracting with a payer, typically contract with the payer and say, hey, let us take care of this population. And if we take care of them in a better way, better outcomes, better price, you can share in the savings with us. So that's how we do it from a business model standpoint. So from go up a level, we cost the system less. Patients love it. Practices who can't possibly call patients all the time between visits to check in on them. We just heard today they get 100 messages a day. 100. You can't do that effectively, but everybody's in this business to make patients feel better. So how can we do that? I feel really, really good about what we are doing for the system because it's very, very well aligned.